Next, we have Sebrina Barrett.
Thank you for the opportunity to testify. Imagine waking up to learn that the nursing home your mother depends upon is closing, and there are no nearby alternatives. That's the reality many New York families now face as our long-term care system rapidly deteriorates. Our nursing homes are in a crisis, a closure crisis, and we are losing the good ones. The nonprofit nursing homes that invest in staffing, quality, and their mission to compassionately serve New York's families. Although nonprofit and public nursing homes make up only 33% of the nursing homes in New York, they account for 75% of all nursing homes recognized for top quality under the state's most recent NHQI results. Yet, since that list was created, 7 of those high-quality homes have already closed or been sold. The rate of closures is accelerating. We've lost more than 4,000 beds since 2014, but about 1,200 of those since 2024 alone. That's 25% of our closures in just 2 years. The primary driver is inadequate Medicaid reimbursement rates, which are still based on 2007 costs, leaving providers underwater by an average of $150 per resident per day. 1,000 more beds sit offline because we can't find people to staff them or pay the competitive rates they deserve. And nearly 70,000 beds are operating in financial distress. That's more than 2 out of 3 statewide. And this crisis extends beyond nursing homes. Adult care facilities continue to close, and half of the adult day health care programs have yet to reopen after COVID. Most New Yorkers don't realize how deeply this affects them. Hospitals depend on nursing homes to discharge patients, and when they can't, ERs back up and people wait for care in hallways. Families travel farther to find a nursing home bed or shoulder impossible caregiving burdens at home. In our executive budget, Governor Hochul proposes $1.5 billion in new funding for hospitals and nursing homes, the only new funding stream for nursing homes. We are asking for half of this allocation to begin to stabilize the sector. Importantly, we aren't asking for half of all the funding that hospitals might receive. There is more than $4 billion additional dollars proposed for hospitals. We are just asking for half of this one allocation. We also support restoration of the 10% capital cut and request reinstatement of the remaining 5%, the only funds available for nonprofits to make essential repairs and service loans. Let me close with this. We're at a crossroads. One path leads to more closures, more distressed hospitals, and families pushed past their limits. The other leads to sustainable, compassionate, long-term care system that protects older adults and strengthens communities. With targeted investment, including directing half of the new funds to nursing homes, we can choose the better path. Thank you.
Ms. Barrett, you brought up in your testimony about LeadingAge asking for half of the $1.5 billion investment. Why does LeadingAge think that the nursing home should have half that funding?
So nursing homes rely on Medicaid heavily. We have about 73% of the folks we serve rely on Medicaid as the payer, and so there's really no other space, no other place to make up those costs, whereas Medicaid is funding only about 75% of the actual cost of care. So our nursing home members are having to find another way to make up that 25%, and it's simply unsustainable at this point. The other thing that's happened is the case mix freeze has cost the system to lose about $100 million per year. So by the end of 2026, that's $300 million additional dollars that's been taken out of the nursing home system. And we believe that the only way to stop the closures is to get our reimbursement rates closer to the actual cost of care.
If that were to happen, would facilities that have had to take beds offline, would they be able to bring those beds back online? Would they be able to hire the staff they need to be able to function to the top of their licensure?
That's certainly our hope. Our members are mission driven and we want to staff as good as possible. That's the reason why 75% of our members are the ones that are in the top quality as far as nursing homes go across the state. And part of the reason we are taking beds offline is because we can't afford to pay the competitive rates needed in order to staff those beds. So absolutely, funding increase would go directly to providing better care for the residents that we serve in the form of hiring more staff.
Thank you.